When a baby is crying and cranky, what do we usually give them? A pacifier or a bottle, right? Babies tend to use these as a coping mechanism when they're either sleepy, cranky, teething, whatever the case may be. We tend to give them a pacifier and or a bottle. We tend to use bottles at night to get the baby really fed so they can sleep throughout the night. Today I will talk about some things that many of us do not know when it comes to the usage of pacifiers and bottles beyond the age of 1 or 2. So prolonging the use of a pacifier causes what we call an anterior open bite. An anterior open bite is when your upper front teeth protrude out and they do not touch your lower bottom teeth when you close your mouth. The more the baby sucks on the pacifier, the more the baby's upper arch begins to form the same as the pacifier. Babies are like little sponges. Their body grow and form is what they're used to using. To avoid the possibility of an anterior open bite is to basically break the habit of using a pacifier. There are a couple of ways you can break the habit of using a pacifier. You can go cold turkey, or you can just cut the tip off the pacifier and eventually the baby will be like, oh no, this is not what I'm used to, and will stop using it. According to a few doctors in a postgraduate program in child and adolescent health, said that depending on the extent of the open anterior bite, it can improper mastication, which is eating, swallowing, and breathing. It also can cause a negative economic effect on the family due to how expensive it is for the treatment to correct it. The only possible way to correct an anterior open bite is with orthodontic treatment. Orthodontic treatment can run from $4,000 to $5,000 depending on the extent of the treatment. Also, sucking the thumb of fingers can do the same to create an anterior open bite. That's a little bit more tricky when it comes to fingers because you can't just get rid of their fingers. But there is the orthodontic treatment for that as well. It's kind of when they put in an appliance where when they stick their fingers in there and they bite down, it pokes them. So it hopes for them stopping to suck their fingers so we can correct the anterior open bite. Okay, did you know that babies and toddlers who use bottles at night are at higher risk of dental caries? A study was done by some dentists in Saudi Arabia, and it showed that this type of feeding behavior intensifies the risk of caries. The oral clearance and the salivary flow water are decreased during the sleep. It truly depends what's in the bottle at night that creates the caries. If you put your baby to sleep with milk or juice or anything of that nature, you would definitely begin to see dark spots, which is what ultimately will lead to the caries. Generally, if you are going to put your baby to sleep with a bottle, we prefer for you to put water in there. After you brush your teeth, if you give the baby water, they can do the same thing, put them to sleep. The study shows that this condition usually affects the primary maxillary, which is maxillary means upper, anterior, which means front, so teeth first, and then the primary molars in the back. The lower teeth usually are affected by this due to the baby being in the sucking position, and when the sucking position generally covers the lower teeth, so these teeth are safe. Ways to prevent this is, like I mentioned before, to strictly give the baby water once you brush their teeth at night, to give them nothing but water, because water, of course, does not have anything in it to create cavities. The milk and juice holds sugars in it all night, so it causes the cavities. The treatment for this generally is fillings and or crayons. I'm sure most of you guys did not know this, but I think this is valuable information, especially for new parents. And although this speech was just strictly about babies, it is also important for adults to know this as well. Thank you.